And so if we only do this for 2 weeks and go, I take it and I'm not getting any better, well, 2 weeks might be a little too short of a time, and we might actually need to give it a longer period of time. All right, what's up everybody? Another episode of Daily Doc Talk, keeping this on a roll. If you guys are finding this valuable, please leave comments. Let me know if you like these longer form videos where we talk a little bit more in depth than our little short micro videos that we do. Let me know. So what I want to talk about today is this concept that whenever we are approaching chronic pain, there are kind of two categories of responses that we can have with any type of therapy, whether it is surgery, whether it is injections, whether it's supplements, whether it's lifestyle changes. And these responses are things that occur quickly and things that we notice quickly and things that are a little bit more long-term. And we have to make sure that we're giving time for the therapies, whatever it is, to actually work. And so let's just talk about some supplements, for example. So if we have somebody who has, let's say, some neurogenic inflammation, which is a common thing that we treat here, we start to notice that there are things that can be helpful short term. There are things that if somebody takes something, they can notice a relatively quick improvement in their pain. And there are other things that we know to help nerves in the long run, but we don't necessarily notice a big improvement, within an hour of taking that supplement. And again, we're using supplements as an example. And so with this, some different things. So a lot of people with neurogenic inflammation are going to see benefits with alpha lipoic acid. Alpha lipoic acid helps improve blood flow to small nerves. And with that, we can get improvement in symptoms. Now, a small portion of people will notice more short-term or more immediate benefits. They take a dose of alpha lipoic acid. Let's say they take the kind of standard 600 milligrams, and they're going to see an effect within about an hour or so. Their pain can start to improve. Other people, though, don't necessarily see that immediately, right? They might take it and they might not notice anything. Now, that doesn't mean that the supplement is not helpful for them. At some point, we want to make a decision if we think the supplement is helpful, but that generally takes time for us to know. Sometimes that's 4 weeks, sometimes that's 3 months, sometimes that's 6 months. Different supplements are going to kind of have different time frames in that realm, and that's something that we have to pay attention to. We look at the research. Okay, if somebody takes this and they see a response, roughly how long did this take? Things like that. So for alpha lipoic acid, we're generally telling somebody, hey, we're probably going to be on this kind of 6 to 12 weeks before we evaluate if you've seen improvement. Now, if somebody starts on alpha lipoic acid and 12 weeks later, they're like, my pain is no different, then we can come off that supplement because we don't think that it's being beneficial. But if you only do that supplement for a week, you can't really say that it was or wasn't beneficial because a week is not enough time, especially if you're not noticing those more immediate benefits. Another example is magnesium. So one of the ways that magnesium can help with neurogenic inflammation is because one of the ways that neurogenic inflammation gets propagated or continues after it has already been started is because of muscular tension, myofascial tension that continues to mildly compress on the peripheral nerves, which our brain can then perceive as painful. Magnesium can help to relax muscles over time. And so we know that magnesium tends to help patients with neurogenic inflammation. Now, again, a small portion of people might notice some kind of short-term benefits from the magnesium. They take a nice dose of magnesium. We like using a slow-release magnesium called Mag SRT. It is easier on the gut, meaning it doesn't cause as much osmotic diarrhea, which is not fun to deal with. And so we actually get better magnesium levels and improvements because of that. Let's say somebody takes that and a small percentage of people might notice improvement in that kind of hour in their pain, but not everybody does. Now, for the people where it doesn't, generally with that, we're looking at about 3 months for the magnesium supplementation for us to really assess if it was helpful. And so if we only do this for 2 weeks and go, I take it and I'm not getting any better, well, 2 weeks might be a little too short of a time, and we might actually need to give it a longer period of time. Now, again, if you're on it for 3 months and you're like, there's no difference in my pain, Then you can have the discussion with your doctor about coming off that. The interesting thing about magnesium is that a lot of people see other positive benefits with magnesium, even if their pain doesn't improve. And so some people will continue to take that. So those are just some things to think about when you're evaluating how does a supplement fit in with your approach, but also how do nutritional approaches, how do lifestyle interventions, exercise, sleep hygiene, all of that type of stuff. And also, the higher tier therapeutics can also be put into this framework as well. But, if we talk about a lifestyle intervention for a second, we may have, let's say, you may make changes in your sleep. And you might try to, watch the sun rise and get grounding, which is great things to do in the morning. The morning sunrise helps set that circadian rhythm. In the evening, you are reducing light exposure. And you might do that for a week. And you might be seeing a little bit better. You might say, well, my pain isn't any better. Well, that's only been a week. That's not enough time, a lot of the times, for your body to heal, right? We heal when we sleep. And so if you are seeing improvements in sleep and no improvements in pain, it's only been a week, does not mean that it cannot be helpful for you or isn't helpful for you. It might just mean that you haven't given it enough time. So that is our discussion for the day, our short-term and long-term therapeutics, and how you should think about these things and the framework for deciding if something is beneficial for you or not. See you later.